Welcome to Parenting Unscripted. I am your host, Katie Collett, and this is my guest, Jenny Schmitt.
Hey.
She is a labor and delivery nurse with Chesapeake Regional. We're going to have a really good time talking about all things pregnancy related today, including what you should and should not pack for that hospital stay. It's going to be very helpful. But first, Jenny, tell our viewers a little bit about yourself. I know that you are a mother of 4.
I am. I have been a labor and delivery nurse for 13 years at Chesapeake Regional. I have worked my way from new grad to a charge nurse, and I have 4 boys.
4 boys. What is that like for you to have 4 boys?
Wild. Very wild.
I believe that. I have 1 and it's wild. So 4, I can't even fathom.
Yes, ma'am. 4 boys, 11, 9, 6, and 4.
Oh my goodness.
Yes, ma'am.
And you still have the energy to do everything that you're doing.
Oh yeah. I'm a soccer mom too.
Ooh.
My 2 older boys are so into soccer and I am there
I
for
love
it.
that. I
Yes,
think that's so great. Doesn't it feel so good though when you can be at their games and you're cheering them on and you're like, wait, those are mine.
Absolutely.
Yeah.
Absolutely. And I'm very loud. Sorry, boys,
I
but I'm
love
loud.
that. That's the kind of moms I like though, right? You want to be that mom. I mean, you don't want to be the crazy mom on the sideline, but you know, sometimes it's kind of fun to do that.
I could do that.
Have you found, you know, since being a labor and delivery nurse, when you had your own children, did you find that it changed the way that you did your job in any way? Do you feel like it helped you in any way?
Absolutely. So after the first baby, I then understood and I could empathize with my patients, the feeling of those contractions and the pain. And as soon as my moms would start feeling pain, I am like, you want pain control? You want an epidural? I'll go get it right now. Like you definitely feel like you can relate to them more once you become a mother.
Yeah, there really is something special about it because I've always felt, you know, after I had my son, and I feel like, you know, we would both be compassionate people no matter what. But after I had my son, there's just some emotion I feel that is unlocked once you have a baby that you didn't know was even in there.
Yes,
and it just totally changes how you see different things in life. And how you treat people and doing your job. So I can just imagine that for your job, that would really open up a lot. And I know as someone who absolutely requested an epidural, you'd have been my girl at that point.
Yes.
So today we are going to chat with everybody about the preparing for childbirth and the hospital stay. So first, let's talk about preparation for childbirth. We can talk about education to kick things off because I think that education is super important when you're getting ready to have a baby, right?
Absolutely. Absolutely. At Chesapeake Regional, we offer birthing classes. The majority of them are $25, but there is one child prep class that is $75. Okay. It is great to take these classes, especially towards the end of your pregnancy. Us new moms or mothers to be, we have this thing where our brains don't work as well, probably because we're growing a baby in our tummy.
Yes.
So the baby sucks all that education up. So it's better to do it towards the 2nd or 3rd trimester of your pregnancy, just so that you can retain that information and really be able to use it after you have your baby.
I love how you say that. The baby just sucks all that information up.
Sucks it all up.
Yeah. It's so validating though, because there are times during your pregnancy where you're like, why am I so scatterbrained? And
oh yeah.
You're creating a whole human.
Exactly. We call it pregnancy brain. And then after we call it mom brain. So it's totally normal.
Yeah. And I do really like to hear that because I remember having pregnancy brain.
Oh yes.
And I still have mom brain.
Oh yeah.
Nearly 12 years later.
Yes.
So that's very validating. So with some of those classes, do you have classes for moms and dads separately, or is it moms and dads together, or how does that work?
We have all options. So we have classes for moms like breastfeeding, and then we have the new dad class as well, which I love. It's kind of newer. It was not available back when I started to have my baby. So my husband could have definitely learned some new things from that. But I definitely say you should take those classes.
Oh, for sure. And I do love that Chesapeake Regional does have that class for dads as well, because, you know, so many times when you're getting ready to have a baby, all the focus is on mom, but dads play such obviously an important key role.
Huge.
And they have questions too, and they need to have somewhere to go to ask those.
Exactly.
Yeah, I think that's a big deal. Why don't we talk about some of the things to learn in those classes? So maybe we can start with the physical preparation to get your body ready for childbirth. What are some of the things that you recommend that moms do to get their bodies ready when they're still pregnant?
Well, I think that we should stay active. Maybe we should. I love swimming. Swimming is so low impact on your body, but it's such a great exercise to just keep your muscles moving and your body moving. We can start practicing like breathing techniques and doing those fun Kegels to get those pelvic floors ready for pushing. There's just so many things that you can do just to make sure that your body is ready, because it practically goes through war when you're having a baby.
Yeah, that's you are absolutely at war. It is a battle. And I will say too, I know for me, I personally loved swimming because after about 13 weeks, so I got out of the first trimester of all day sickness. And then I was like, okay, I'm in the second trimester. And it honestly was like week 13. And I developed a sciatic nerve issue. And it was to the point where, you'd walk and you'd almost just drop. And I would drop because, that lightning bolt just kind of shoots down your back and your leg. But swimming offered so much relief. And as my belly just kept getting bigger and bigger, you can kind of just float in the pool and you feel good, right? So it helps your mobility a lot.
Absolutely.
Yeah. So you definitely want to stay active there. How about learning some of the positions to prepare your body for childbirth when you go into labor?
So positions as in like when you're in labor?
Yeah.
So there are many positions. There's an endless amount. I honestly would just say come ready and willing to do what your nurse asks you to do with the peanut ball. With our peanut ball, we can put you in so many different positions that will help bring your baby down or rotate your baby. Really just let your nurse be your advocate and be there to help you through positions. I know moms really enjoy laying on their side. So I say always lay on your left side, promotes good blood flow to the baby. Make sure you're getting your kick counts in also. And that's pretty much it.
Yeah. So it's basically, when it comes to preparing for different positions, once you get there, fear not, you have the nurses that are going to really help you get into the most comfortable, productive position.
Correct.
Yeah. And what is it about delivery nurses where you are cheerleaders for us? It's incredible.
Yes. Labor and delivery nurses are literally just little cheerleaders put into scrubs. We cheer you on. We advocate for you. We have like a mind of our own. We want to be there for you. And most of us can empathize with you, what you're going through.
Yeah.
So, we are definitely cheerleaders of the hospital.
Yeah. You are angels without the wings. Absolutely amazing and so necessary. After the break, we are going to talk more about preparing for baby, and then we'll talk about things to pack. And we also have a fun game of true or false. So I'm really looking forward to be able to chat more with you about that, Jenny. And we will be right back after this break right here on Parenting Unscripted. Welcome back to Parenting Unscripted. I am your host, Katie Collett, and joining us once again is Jenny Schmitt. She is a labor and delivery nurse with Chesapeake Regional. Before we went to break, we were talking about how labor and delivery nurses are basically just angels without wings. The wings would get in the way. And the labor and delivery nurses that worked with me were just absolutely amazing. They make you feel like you can truly do anything. So I'm so excited that you took time out of what I know is a very, very busy schedule to come in here and talk to us today, Jenny.
Yes, ma'am. Thank you for having me.
Of course. We want to talk now about the emotional and mental preparation that goes into having a baby, because you really do have to have a positive mindset and just kind of be prepared for whatever your body is going to do. Do you have any relaxation techniques that you try to talk moms through or maybe have them prepare?
So a lot of the times when moms come in, and it's actually common that they come in and they're like unsure about the epidural. I talk to them about how it is very necessary to have your mind in the game. So really breathing through your contractions and maybe focusing inward on things like maybe there's music that calms you or some sort of imagery, looking at pictures of vacation, anything that can kind of take your mind off of the pain or help you breathe through the pain. And I also find that it's wonderful when spouses can help calm your nerves and help you breathe through what you're feeling.
How do you encourage the spouses to do that? What do you recommend that they do if they're in there and they're like, I'm not sure what to do, but she looks like she's in so much pain?
Yeah, of course. So every mom is different. Some of them would love to have their spouse like right there with them, helping them breathe through, and some don't want any communication. But a lot of the times I find spouses massaging mom, like putting that pressure on their back to help, counteract that pressure. Just talking them through it, like even if it's just being quiet during a contraction and then talking to them, between the contractions, anything that they know their spouse, their wife, their, girlfriend needs. That's what I tell them to do. They're just there to help them through and just be present, really.
And I have to laugh. I reflect on what my doctor and the nurses had said to my husband whenever I was in labor. They were like, whatever she might say, just forgive her immediately and keep it out of your mind because she doesn't mean it.
She doesn't mean it.
She doesn't mean it.
It's the pain talking.
Yeah, absolutely.
Yes.
And I will say too, like, I know that my husband in the moment, and I say this for other dads or spouses watching, you just kind of, you go with it and you try something. And if it works, great. And if it doesn't work, we're going to tell you. But I know, when you're getting that epidural, and I'm doing this motion and it's really not that bad, but like when you get the epidural, you're still contracting. And I had to hunch over, obviously, so they could put it in your back. And my husband just came up and I'm mid contraction and it's very painful. And he just put his forehead to my forehead. And really in that moment for me, I never knew I would have needed that, and I couldn't prepare for that. But it was the best thing I think he could have done because it almost felt like I was like pushing that pain into him. Right? So you just don't know until you go.
Right. So always just be vocal, let your spouse know, or your support, your family know what it is that you need, and just listen.
How do you work with doulas? Does Chesapeake Regional have their own doulas, or how can someone bring theirs in?
We don't have our own doulas, but we have many people who bring their doulas in. And doulas are wonderful. They're great support. They will help dad even with supporting the patient. We just encourage, if that's the route that you would like to take, to bring them on in.
Yeah. I love that you have the freedom to do that. How important is positive self-talk? So many times you'll hear people say, I can't do this, especially when it starts to get, you're really revved up, getting closer to the end. How important is the positivity?
It's very, very important. I know that once we get to the end, to the finish line, and we're pushing through, a lot of times you will hear mom say, I can't do it. And the nurses are just there to tell you, yes, you can. You can do it. You have no other option. We're pushing through. We're here. Let's do this. So like I said, I always tell my moms, you have to stay in your head. You have to be positive. You have to just be confident that you're going to get through this and stay positive the whole time.
Oh, absolutely. Here's the thing too. If this is your very first baby, one of the things I was so nervous about, and of course, I say my first baby, one and only for me, but I didn't know how am I going to be able to tell when I'm actually in labor? How do I know when I'm going into labor? So what advice do you give to people to, we can talk about Braxton Hicks first. You start to feel those and you're like, wait a minute, am I going into labor? So can you explain what those are and what people can expect with those?
So with Braxton Hicks, you'll feel tightening to your abdominal muscles, and then it will release and you're like, oh, is this a contraction with my stomach hurting. But the intensity does not increase, nor does the frequency increase. And Braxton Hicks are just tightening of those muscles. That's not going to do anything to help your cervix dilate, which is actually the definition of labor, is contractions with cervical change. So with the Braxton Hicks, if it's tightening, and sometimes you'll feel the tightening only in one part of your stomach, that is a big clue that these are not contractions if it's not getting more intense.
Man, I always wanted, with Braxton Hicks, I was like, okay, this is really helping me get ready for the baby, but really it was just a pain.
Yeah.
Literally a pain.
Yeah, literally a pain.
That's no fair. They should have to do something. Is there a way to kind of get rid of those? Is like drinking water? Does that do anything?
Definitely hydrate. I know it's very hot outside right now where we are. Hydrate continually. If you think you're drinking enough water, drink more. So hydration's big. Decreasing your stress is big. If you are really stressed out, your body is going to feel that and you're going to have contractions, false contractions. So they're not even doing anything.
Man.
Yeah. So just make sure that you take care of your body and that's it.
Perfect. That's great advice. I think for anyone pregnant or not, right?
Yes.
Just take care of your body.
Take care of your body.
Right. So when it is go time, what can you expect when you first arrive at the hospital? Do you have to sign a lot of paperwork? Is that something you can do ahead of time?
So you do need to do your pre-registration. So you can find the form in your office, your physician's office. You fill that form out and you come in and give it to our registration so that when you do get there and you're in pain, you don't have to go through that process again. When you arrive to us, you will go on the OB/ED side. So that's where we will check you in, get you in a room, and then you'll have a nurse, midwife, and or physician that will come and evaluate you and tell you if we think you're in active labor or not.
All right. In just a minute, we're going to come back. We're going to talk more about what happens during the actual birthing process. And we are going to touch, like I said, on what to pack, what to leave home. And we're going to play a little round of true and false. So we are going to be right back with Jenny Schmitt in just one moment. We are back now on Parenting Unscripted. I am your host, Katie Collett, joined by Jenny Schmitt, labor and delivery nurse of Chesapeake Regional. We're going to pick it up right where we left off, talking about some birth plan options. So what can people, when they go into the room, I know for me, they're like, do you have a birth plan? And I just had them put epidural in all caps on the whiteboard.
So with birth plans, you can bring one or don't. If you're a very organized person and you like to plan it out to a T, go for it. I just want you mamas to remember that everything does not always go as planned. You can have things that you definitely don't want or things that you for sure want, like taking your placenta home with you, or you want delayed cord clamping. There's so many different things and options that you can come up with, but just make sure you're flexible. Just use your nurse as your advocate, and just, if you don't understand why something can't go the way you had planned, just, talk to them about it and get the reasoning, because we are more than happy to accommodate what your vision is for a perfect delivery. We just have to make sure everything is safe for you and baby.
Yeah, and really just be prepared to go with the flow.
Go with the flow.
Whatever happens.
Absolutely.
Do you have the option there to, for the moms while they're laboring, to walk around or potentially get in a tub if they would like to?
So we don't have a tub anymore, but we do have the option of showering if you really feel like water therapy is your thing. And with ambulating or walking on the unit, we very much love walking on the unit. The only issue is if you're on a medication, we have to monitor that baby just to make sure the baby is handling the contractions well. But ambulating, as far as we can monitor baby, we're for it.
Yeah, that's great.
Yes.
So how long can a mom expect to have to stay in the hospital after she has her baby?
So if it's a standard vaginal delivery, it's typically 24 to 48 hours. For a cesarean section, it would be 72 hours. Also, the mom tends to get discharged before the baby. So the baby needs to be watched for at least that 24 hours. So we just make it the same timing for baby. So there's really not much of a recovery for you as it is baby.
Understood. That makes sense. I
Yes.
understand that. Let's talk about packing for the hospital and getting ready. What are some of the do's of packing that you would say you must bring?
Do's. Okay. I would say bring your pillow. If you're a pillow person,
Yes.
you need to bring your pillow. I would say bring phone or something to take pictures with. Maybe if you have your own gown that you want to wear, just make sure it can easily open from the back in case you do want to get an epidural. So a gown. That's pretty much it. I mean, honestly, we supply everything that you could need. And when you're in labor, the only thing you need to focus on is having that baby.
Yeah, absolutely.
So you don't need a car seat yet. You don't need any of that. Just bring yourself.
Yes. I know a friend of mine who was kind of like my pregnancy mentor. She had a baby before me. She had recommended bringing a towel from home so you could have like a towel that was the size you liked it to be. And I actually love that. It was just something so simple to pack, but she was right because I'm taller and my towel had like full coverage when I finally could get that glorious shower after I had my baby.
And speaking of shower, maybe some shower shoes or flip-flops.
Oh, yeah.
If you don't want to step on just the bare floor, that would be a good thing to bring also. But a towel is smart.
Yeah, that is a very good call. And I date myself, but I had my iPod back whenever iPods were a thing. I had my iPod with my headphones in, and I thought I was living large because it was just nice to have music in the room while I was laboring. And frankly, I had the epidural, so I was just so comfortably dozing.
I love walking into a room and having that music playing and just that like soothing, calm environment. I love that. So if that's your thing, bring it in.
Is it true, Jenny, that whatever is opened, in the little cart that the baby is brought in on, if there are wipes opened on that cart or anything that's opened, is it true that you can just take that with you because you've already been charged?
Absolutely. Take the diapers, take the formula if you're formula feeding. There's little hats for the baby that we put them in. Take it. Because once it's open, it is yours.
Love that. If you're being charged for it, take it on home.
Take it.
And you really guide the moms and dads through that, right? Like, be like, take
we
this.
also will make you like a little goodie bag to go. So we'll pack some extra like of those fancy mesh underwear that you can throw out when you're done with them.
Yes.
So, take all the things and resources that we offer to you. Take them home.
Okay. Are you ready now for true or false?
Okay. I'm ready.
We are going. I've been looking forward to this since the moment I knew that I was going to talk to you. So, of course, when a mom is due or overdue, we're like, evict this child. It is time to go. I'm going to do what I can.
Let's get it out.
Tell me if this really does, true or false, does this kickstart labor? All right, true or false? Eating spicy food will kickstart labor.
False. Ooh. I don't think eating spicy food does much of anything besides give you maybe some indigestion.
I was going to say, it might just kind of give you heartburn. Having sex will help you go into labor.
True. Yes. Especially towards the end of your pregnancy. So if you're having sex like regularly during your pregnancy, it might not be as effective, but like towards the end of your pregnancy, oh yeah.
Man, right when you're like, I feel the least probably attractive I possibly could.
Yeah.
Oh my goodness gracious. All right. Drinking castor oil will help you go into labor.
Okay. So this is kind of a true and false. So drinking castor oil will actually make you get an upset tummy, kind of like diarrhea, which then it will push you into labor because when your abdominal muscles are contracting during that crampy diarrhea stage, it'll kind of irritate your uterus, and your uterus will be like, oh, are we supposed to be doing this? Are we supposed to be contracting? So if you want to do the castor oil, just be prepared for the diarrhea the entire time you're in labor.
That sounds awful.
Yeah.
No. Pass. I don't, nope. That just sounds no good.
Yes.
A foot or ankle massage can cause labor to begin.
I think that could be true. So a lot of, people say that there's like points in your foot or your ankle that have something to do with the activity of different muscles and parts of your body.
Mm-hmm.
So, I mean, if you have the right type of massage, maybe if they know what they're doing.
Yeah.
But I've never had somebody come in and be like, I had the foot massage. Let's go.
This did it.
Yeah.
All right, Jenny Schmitt, thank you so much for taking the time
Thank
today.
you for having me.
It was such a fun conversation.
It was.
I want to have you on just for like a full episode of True and False.
Count me in.
Man, that
I'm
was
here
so
for it.
great. I love it. Thank you so much for taking the time
Thank you.
today. And everyone, thank you so much for joining us for this episode of Parenting Unscripted. Remember, new episodes air every Tuesday morning at 9 o'clock. Thank you so much for joining us today, and you be good.